In this podcast episode, Dr. Daniel Amen, a renowned psychiatrist and clinical neuroscientist, shares his deep expertise on ADHD, attention deficit hyperactivity disorder, its diagnosis, treatment, and the broader societal context that influences how we understand attention and distraction today. The conversation delves into the complexities of ADHD, the challenges of distinguishing it from modern-day distractions, and practical strategies for managing symptoms effectively. Dr. Amen opens by addressing a common question. How can one differentiate between true ADHD and the distraction caused by living in an overwhelmingly fast-paced, technology-driven world? He explains that ADHD is a neurodevelopmental disorder with a strong genetic basis, often inherited from parents, and characterized by persistent patterns of behavior over time. Unlike occasional distraction, ADHD manifests as a short attention span, specifically for routine, everyday tasks such as homework, chores, or paperwork, while individuals may still focus intensely on novel or highly stimulating activities. This paradox often misleads people into thinking they do not have ADHD. He highlights that people with ADHD are easily overwhelmed by sensory input, too much noise, visual stimuli, or tactile discomfort, which their brains struggle to filter out due to underactivity in the prefrontal cortex, the brain's executive center responsible for focus, impulse control, and organization. This inability to suppress irrelevant stimuli leads to chronic distractibility and disorganization, which are hallmark symptoms of ADHD. Dr. Amen discusses how society's current environment exacerbates attention problems. The constant bombardment of information, estimated at 72 gigabytes per day, and the prevalence of ultra-processed foods, chronic stress, and digital addiction create a fertile ground for distraction. He critiques the quick medicalization of these symptoms, noting that many people are prescribed medications like stimulants or SSRIs without addressing underlying lifestyle factors. For example, SSRIs, commonly prescribed for depression, can increase serotonin but lower dopamine, making patients feel happier yet more distracted and impulsive, which can worsen ADHD symptoms. He also points out the paradox of ADHD being both overdiagnosed and underdiagnosed. Overdiagnosis occurs when normal distraction is mistaken for ADHD, while underdiagnosis is common in females and those without hyperactivity due to gender biases and misconceptions about the disorder. Untreated ADHD, especially in adults, can lead to serious consequences such as school failure, substance abuse, incarceration, and relationship difficulties. One of the most valuable contributions Dr. Amen makes in this episode is his explanation of the 7 distinct types of ADHD, expanding beyond the classic hyperactive and inattentive categories recognized in the DSM. The first type is the classic ADHD with hyperactivity and impulsivity. The second is inattentive ADHD, more common in girls, characterized by distractibility and procrastination without hyperactivity. The third type, overfocused ADHD, involves difficulty shifting attention and rigidity, often seen in children of alcoholics. The fourth, limbic ADHD, combines ADHD symptoms with mild depression and a persistent negative outlook. The fifth type, temporal lobe ADHD, includes mood instability and irritability, sometimes requiring anticonvulsant medications. The sixth, known as ring of fire ADHD, involves excessive brain activity and emotional volatility where stimulants can worsen symptoms. The seventh type is anxious ADHD, marked by anxiety alongside distractibility and disorganization. Understanding these subtypes is crucial because treatment must be tailored accordingly. For example, stimulants may help some types but worsen others, underscoring the importance of accurate diagnosis and personalized care. Before turning to medication, Dr. Amen strongly advocates for non-pharmacological interventions. He emphasizes the importance of a digital detox to reduce overstimulation from screens and social media, which can mimic or worsen ADHD symptoms. Equally important is an elimination diet that removes gluten, dairy, corn, soy, artificial dyes, and sweeteners. He cites research showing that about 70% of children on such diets experience significant improvement or remission of ADHD symptoms. This is because the brain consumes a disproportionate amount of the body's energy, and poor nutrition, especially from ultra-processed foods, can impair brain function. For instance, gluten and dairy break down into compounds that act like opiates in the brain, causing spacing out and reduced focus. Dr. Amen's wife, Tana, has authored cookbooks focused on brain-healthy foods, reinforcing the idea that what we eat profoundly affects our cognitive and emotional well-being. He encourages parents and individuals to try these lifestyle changes for at least a month before considering medication, as true ADHD symptoms will persist beyond that period. While lifestyle changes are foundational, Dr. Amen acknowledges that medication is often necessary for many with ADHD. He compares withholding medication from someone with ADHD to withholding glasses from someone who cannot see, calling it neglect. However, he stresses the importance of careful dosing and monitoring to avoid suppressing personality or causing unwanted side effects like appetite loss, sleep difficulties, or increased tics. He also explains how stimulants work by increasing dopamine availability in the brain, improving focus and impulse control. Yet, medication is not a one-size-fits-all solution. Some ADHD types respond poorly to stimulants and require alternative treatments such as anticonvulsants or supplements. A significant challenge for many with ADHD is emotional dysregulation. Dr. Amen notes that people with ADHD often experience emotions more intensely and may struggle with impulse control, leading to regret and strained relationships. Medication can sometimes blunt emotions, which some patients dislike, so treatment must balance symptom control with preserving emotional richness. He also discusses how untreated ADHD can lead to negative seeking behaviors, such as conflict or risk-taking, as individuals attempt to stimulate their dopamine systems. This can contribute to higher rates of substance abuse, especially alcohol, which is heavily marketed and socially normalized despite its health risks. Dr. Amen highlights the genetic nature of ADHD, but remains hopeful about breaking the cycle through early intervention and education. He stresses the importance of brain health starting before conception, as a mother's health and environment influence the genetic expression in her children. Public policies informed by neuroscience, such as later school start times and restrictions on social media for children, can also support brain health. He warns against early exposure to smartphones and social media, advocating for children to avoid these until at least age 15 or 16, citing Australia's recent ban on social media for minors as a positive example. Throughout the episode, Dr. Amen emphasizes compassion and understanding for those with ADHD. He shares personal stories, including his own family's experiences, to illustrate the challenges and triumphs of living with ADHD. He encourages people not to see ADHD as a life sentence, but as a condition that can be managed with the right combination of lifestyle changes, medical treatment, and support. He also calls for a brain health revolution, urging society to prioritize brain wellness through nutrition, reduce digital overload, and informed public policy. By doing so, we can improve not only the lives of those with ADHD, but the cognitive health of future generations.